A lot of the things we tend to hear are that it's compassionate care, it's empathetic care.
When you're able to spend so much time with them, they walk out the door feeling like you're devoted and that you truly care.
When I see people smiling, they're like, I'm so happy when I come to see you. I feel better when I come to see you.
I became a physical therapist because I want to help improve people's quality of life. I want to get people back to the things that they enjoy doing.
The overall goal is to make them better, but to make them feel comfortable in the process, to trust us, partner with us, and believe that we can make them better.
When the patient comes in, we discuss a lot of what their goals are.
What is the number one thing that you want to get back to doing, whether it's picking up your grandchild or being able to run a marathon.
Maybe you just want to cook dinner without so much pain.
As a team, we work on the best way to get them to achieve those goals.
The first treatment with the patient is a lot of listening. You want to, one, build up that trust that you're there for them.
Once you've established that trust with the patient, you've got the ability for them to be a much more active part in the rehab process, which is really the key to a positive outcome.
Really what this is about is healing a person, making sure that change in a good way happens.
I think the care I've been receiving since day one's been fantastic. Just learning certain little techniques of lifting that you don't normally pay attention to, and it does make a difference.
Communication's a vital part of therapy, whether it's between the therapist and the patient, between two therapists if a patient's seeing more than one, or between the therapist and the doctor to keep each other up to date on plan of care and what's been happening in therapy. So we really try our hardest to document as much as possible and be as detailed as possible in our notes.
It's nice for the patient to know that we're all the same team.
Without these two people, I would not be where I am today, and I'm so grateful. I mow my grass now, I drive, I do everything that everybody does, which makes you feel complete as a person.
They're very professional, they're friendly. It's pretty much like my second family now.
We always say our doors are always open. We love to see patients who aren't injured come back and say hi. And when they're feeling good and tell us all the things that they've been doing.
They're telling me all about how they've been playing with their grandkids for weeks and it feels great. And they're so happy that they can do that. It's my favorite feeling in the world.